So people that have questions, let me just address the question. I'm going to something interesting.
So we had about 3 questions initially. Asked that is irregular menses bad? So I think you should attend to that one.
Okay.
Is irregular menses bad? If your menses is irregular
Okay.
or are irregular, is it bad?
So now irregular menses is bad. If I can say it like way, it's bad. It's bad for somebody who is trying to achieve pregnancy. And it's also a pointer to your ovarian reserve. And it's also a pointer to probably a person has pelvic inflammatory diseases and the likes. There are many things that can cause irregular periods. One, do you have polycystic ovarian disease? Polycystic ovarian disease is a disease whereby the person is forming cysts irregularly, having insulin resistance, diabetes, and the likes. Let me not go to there. If you have questions on that, doctor can do a short video to address polycystic ovarian disease. So she said dark blood, don't forget.
Everything.
Okay. So ovarian, so yes, having irregular period is terrible. Then another thing that can cause irregular periods is infections. Some infections can affect your periods, can make your periods irregular. Now, why did I say it's bad? As I said, for someone that is trying to get pregnant and you have an irregular period, like how I did, I had an irregular period. You can't even determine when I'm ovulating. I can't determine when I'm not supposed to meet my partner, for those people that are using natural forms of contraception. And that is where I'm going to today. I'm going to contraception at the end of this video. That is where I'm going to. So for some people, have you done contraception before?
Not done. I have a video on it. I've not done it.
Okay. So doctor say he has a video, so we'll just elaborate on this video. So second, infections, as I said. Then because you are trying to get pregnant and you don't even know when you're ovulating, you don't know what time you should meet your partner. For those people that are having natural forms of contraception, they want to do what we call the day safe period, the day I'm safe, the day I'm unsafe, like that. When you have irregular periods, there's nothing you can't really determine. Then another thing is, when you have a regular period, sometimes for some people it tends to be heavy. They come with anemia and the like. So it's better for you to find a solution or know why you're having a regular period. Is it due to hormonal problems? Is it due to a disease, like as I said, if pelvic inflammatory disease, cervicitis? Is it due to cancers? You need to find out. Is it due to metabolic problems like diabetes? Are you on drugs? Is it due to drugs? Drugs too affect periods. Stress affects periods. Are you stressed? Are you working so hard? Are you sleeping less? Your diet too matters. So those are one of the things you need to know. That's why I said irregular period is bad. It doesn't reflect that you're having a good reproductive system.
So the next question says, dark blood in menses, dark blood in period.
Okay.
Is it bad or what does it mean? I think that's what Annie said.
Okay. Dark blood in period. Okay. Let me first of all say, how are my periods supposed to be? Now, a normal period. When I say normal period, I'm not talking about cycle. I'm talking about the days that you bleed. A normal menstrual bleed is supposed to be from 2 days to 7 days. You're supposed to bleed from 2 days to 7 days. Some people will say 3 days, but let me just leave it at 2 days to 7 days. At least 2 days to 7 days, you should see the bleeding. Now, when you mean normal, I mean having blood. When you cut yourself, you see fresh blood. That is how it's supposed to be, as fresh as that. Yes, as red. It's supposed to be a bit bright, not so black, not dark. Oh, I wish I can get a picture. Let me see. Okay, yes. I don't know if you can see this. It's what I'm wearing. Something close to this, but just a little bit darker than this, like maroon kind of. I don't know if maroon is the right this I'm supposed to use. Something like that you're supposed to have. Then there should be no clots in it. When you start passing a lot of clots, it simply means that you're having heavy menstrual bleeding. And heavy menstrual bleeding translates to someone changing his pad at least 4 to 5 times in a day. I'm not talking about hygiene wise. Me, I can use 5 pads a day. I can even use 6. And my period is not heavy. Just hygiene, just my own natural self. When the blood comes out, I just feel like getting the sanitary towel out of me. But I'm saying it is soaked. It is fully soaked that sometimes you get stained. that is at least changing 4 to 5 times in a day. That is heavy period with clots, associated with clots. That is heavy menstrual period. Now, why dark blood? What dark blood simply signifies is that there's accumulation of blood in your uterus. Blood is accumulating in your uterus, probably because of it's heavy, or probably you have fibroids, so it's not healthy. And for those that have infections too, they are prone to passing dark blood during their menstrual period. I don't know if I can.
So, when we say, okay, so let me explain what goes on during menstruation, what goes on during menses, because it's important that we understand what menses is. There's some culture that will tell you if I don't menstruate, it means there's bad blood stored in my body, and then there's a bad thing happening about it. But now, menses, or when we say menstruation, happens after ovulation. And why does it happen? Every month, the uterus prepares to have a baby. Every month, the ovary releases an egg or 2 eggs, with the expectation that this woman is going to meet a man and we're going to have a baby. So during the month, all through the cycle, the uterus prepares itself. The walls of the uterus prepare itself, having blood vessels going in, preparing itself for a baby to come in. But if it happens that when the egg dropped, there was no sperm for that month, and there was no fertilization for that month, all the preparation of the wall is washed out. And how is it washed out? It's rubbing or squeezing of contraction of the muscles. That's why most people feel pain when they're having their menses. The contraction of the muscles of the wall of the uterus, trying to remove what has been prepared over the month. And yes, because blood vessels are there, arteries are there, the blood is going to be bright red. But you may find some pieces that may look like clots there. Why is this? Because part of the wall of the uterus that has been removed is going to come in front of clumps. So it may not be really many clumps, but you're going to find some clumps in the blood, which means the wall of the uterus, which is actually tissue, not just blood, has been washed up, has been scraped off. So I usually use this example. I say, look, you have a very important person coming to your family or coming to your home. You prepare your house, you clean up, you borrow things, you arrange your house. And later the person tells you, oh, sorry, I had an appointment, I'm not coming again. All those things you borrow, you're going to return it. And that's what happens with menses. Every month, your body expects to get pregnant. Oh, there's no pregnancy. Let's clean and prepare for next month. Better luck next month. That's what happens. So you may find clot in it, but it's not supposed to be dark. It's supposed to be bright red, because like I explained earlier when I was talking about sickle cell, blood from the artery that has oxygen is supposed to be bright red. It's after the blood has lost its oxygen that you now see it looking deep red and brown. So I have a video on my page that talks about the different color of menses and what they are likely to mean. You can go on my page and look at it.
Okay, so
yeah, there was a question about Pap Smear.
Okay, for Pap Smear, usually depends on age and depends on some countries where you are. I'm going to use the country where I'm comfortable using. So we expect that from 25 years of age, you start doing your Pap Smear every 3 years. 25 to 49. But immediately you are 50 years and above, you do it every 5 years. Now, another thing about Pap Smear is that if you have a family history of probably cervical cancer or any other cancer, breast cancer, it's important to go to your doctor. He will schedule. Some of them even do it every year. Or if you have had a Pap Smear that was abnormal in the past, it is important to do it every year. The doctor would tell you how to go about it. And some of them will do for you some genetic testing to determine. Some will do some genetic testing to determine. So, okay, what is Pap Smear, please? Okay, Pap Smear is a screening test that is used to screen for people who are susceptible to cervical cancer. Now, what is cervical cancer? Remember in my picture when I was teaching, I showed you the part that is directly above the vagina. Am I supposed to use the word vagina? Okay. The part that is directly above the vagina, that connects to the uterus, that connects to the womb, is the cervix. So they check the cervix to see those that are predisposed to cervical cancer. So what are the risk factors for cervical cancer? Have you done that before? The risk factor for cervical cancer is 1, unprotected sexual intercourse. early exposure to sexual intercourse. So people or teenagers that are having unprotected intercourse from 16 years, 12 years, 13 years of age, you are having exposure to intercourse at an early age is a risk factor. Now, multiple sexual partners, those that have multiple sexual partners, that is, and are unprotected, yes, unprotected multiple sexual partners. I'm with the A today, I'm with B tomorrow, like that. But that is another risk factor. Then those who have a family history of probably breast cancer, any cancer of the body, particularly breast, uterus, maybe anybody in their family has it, especially first degree relatives. A first degree relative is your father, your mother, your siblings. Your second degree relative, maybe your uncle, your auntie, like that. People that have had cancer in your family, they are predisposed. Then, of course, smoking too, predisposed to almost all forms of cancer. So that is it. So how do we prevent cervical cancer? For those people that feel or know that they've been exposed in one way to probably partners or early sexual exposure, it's better for them to go and have the Pap Smear done. And if it is negative, you now go for your vaccine. They vaccinate you against the virus. It's a virus that causes cervical cancer. So, and it's sexually transmitted. So you go and have your vaccine done. You have a vaccine taken. Then, for those people that have predisposing factors or risk factors I mentioned, maybe family history, maybe their mother has cervical cancer or their aunt, you can just go on to have the vaccine. Take the vaccine. It's important. Even those people that do not have multiple sexual partners, if you can't take the vaccine, please go have the vaccine taken.
Okay, so thank you. Said men also have to have their checkups also. So I think I did a pretty comprehensive live on male infertility, erectile dysfunction, and prostate problems. So within those three, there's also seminal fluid analysis I will do for men. When the woman is getting treated for infection, the man also has to get treated for infection, because we don't want to treat the woman and have the man introduce the infection back to her. So when we are treating couples, or when we are treating women, we treat them as a couple. Whatever we are doing for the man in form of screening, and for the woman in form of screening, we also do for the man. So we are making sure that both of them are healthy. Whatever counsel we are giving for fertility for the woman, we're also giving a similar counsel for the woman, for the man too. Yeah. It's a very rare opportunity. My wife suggested it, and I just thought
I hardly come around. I just thought
let's just have the live